I'm Dr. P Kosygan, Senior Consultant Orthopaedic Surgeon at Apollo Hospitals, Greens Road, Chennai. I specialize in joint replacement surgery, particularly of the hips and knees, both primary, complex and revision joint replacement surgery. Rehabilitation around joint replacement is an important aspect to achieve a good outcome after joint replacement surgery. It is not about the 2 hours of my surgical work in the theatre, which is alone important for the outcome. In fact, why I put around joint replacement surgery is because the rehabilitation ideally starts even before someone undergoes the surgery. After counseling the patient for a joint replacement surgery and scheduling the dates, we in fact start the rehabilitation before they get admitted into the hospital, so that we can understand what the patient is capable of, what are the other joints involved, and what we can expect post-surgery. So our physiotherapist, they assess the patient, initiate some truncal and lower limb exercises, and teach them the exercises they need to continue at home. Now, the rehabilitation has come a long way, because the early days when I started joint replacement surgery, we didn't mobilize them at least for first 2-3 days. Now it's a complete turnaround, that the whole mantra is early mobilization. So someone has a surgery in the morning, they get mobilized the same day, and the exercises surrounding the joint starts the same day. And one may worry how they can cope, because there may be severe post-operative joint pain, but with excellent post-operative pain management care, we are able to achieve this. The early mobilization and exercise following joint replacement, so much so that we are able to discharge some of these patients within 36 hours or 48 hours. There is no real race between two patients to comparison. I think one's individual capability also is important, and this is why the pre-op assessment is important. And also, rehabilitating according to the needs of the patient is the other essential aspect. For instance, sometimes we have patients who have both hip and both knee problems. Sometimes it may be the only one joint. So it is difficult to compare these two groups. But the common philosophy is early mobilization, encourage the patient to use the joint from day one, and show them the exercises which they need to continue for an extended period of rehabilitation at home, with or without the assistance of physiotherapist. We are certainly blessed in this part of the world where we are able to offer them this extended physiotherapy rehabilitation at the comfort of their own house by sending the physiotherapist to their residences. Surgery and getting good alignment of the implant is important for the outcome of joint replacement, but what is more important or equally important is adequate rehabilitation in and around the surgical period.